The unexpected effects of daily masturbation on the prostate. What every man over 40 should know. As men enter their 40s and beyond, many continue to engage in private self-relief as part of their routine, often without giving much thought to the physiological consequences. In fact, a surprising number of men believe that regular masturbation supports physical health, enhances sleep quality, and may even play a role in preventing prostate enlargement. But is this habit truly beneficial, or could there be hidden risks? A growing number of men are beginning to ask a deeper question: can daily masturbation disrupt hormonal balance, or silently harm the prostate over time? While the act itself may seem simple, it triggers a complex cascade of biological responses that are seldom discussed, yet critically important. The prostate, a small but vital gland about the size of a walnut, sits just below the bladder and plays a key role in male reproductive health. It produces the seminal fluid that nourishes and transports sperm. Despite its modest size, the prostate profoundly influences sexual function, urinary flow, and overall pelvic comfort. When neglected or stressed, it can become congested, inflamed, or enlarged, leading to discomfort and long-term health concerns. In this video, we'll delve into 3 significant changes that occur in the prostate as a result of daily masturbation. Each of these is rooted in well-established biological mechanisms and supported by real-world clinical observations. Most importantly, the third effect could be the key to avoiding common but often overlooked prostate issues that many men don't recognize until it's too late. If you're in your 40s, 50s, or older, this content could help you make informed choices about your health and daily habits. Don't forget to subscribe to our channel for more in-depth insights on men's health. And if you've ever had questions about this topic, we invite you to share your thoughts in the comments. We value every perspective in this important conversation. Understanding the real impact of daily masturbation on the prostate. 3 biological mechanisms you should know. To truly answer whether daily masturbation is helpful or harmful, we can't rely on gut feelings or anecdotal opinions. Instead, we must turn to the body itself, more specifically, to the biological systems directly affected by this habit. Let's explore 3 critical mechanisms within the prostate that are influenced by frequent ejaculation, especially as men age. 1. Hormonal regulation, DHT and testosterone balance. One common question is, if daily masturbation were harmful, why does the body seem to crave it so naturally? The answer lies not in emotional desire, but in the mechanical and hormonal responses of the body. Each time a man ejaculates, levels of dihydrotestosterone, DHT, a potent androgen hormone, temporarily decrease. DHT plays a vital role in maintaining male characteristics, but elevated levels over time are also linked to prostate enlargement. Regular ejaculation, therefore, acts as a natural release valve, offering periodic relief from chronic DHT stimulation. However, when ejaculation becomes too frequent, it may cause erratic hormonal fluctuations. This instability can interfere with the body's endocrine axis, the hormonal feedback system, potentially affecting testosterone production. This is especially relevant for men entering andropause, the gradual decline of male hormones with age. 2. Muscular and circulatory response, the pelvic floor and blood flow. Ejaculation isn't just a hormonal event, it's a physical one. The act activates key muscles in the pelvic floor and the prostate, triggering rhythmic contractions that support healthy blood flow, increase cellular metabolism, and help clear out waste material from the gland. This natural stimulation promotes elasticity in the prostate tissue and helps prevent hardening or stiffness over time. But like any muscle group, the pelvic floor needs recovery. Without adequate rest, chronic overstimulation can lead to muscle fatigue, tension, and even reduced urinary control, an issue that becomes more pronounced with age. 3. Immune and detoxification activity, clearing waste and preventing inflammation. Less commonly known is the prostate's role in local immune defense. This gland doesn't just produce fluid, it also processes and removes biological waste, such as dead cells, excess proteins, and inflammatory byproducts. Ejaculation facilitates this cleansing process, lowering the risk of chronic inflammation. However, if the frequency of activity overwhelms the body's natural recovery rhythms, this immune function can become dysregulated. The result? Subtle but persistent symptoms like a dull pelvic heaviness, discomfort, or irritability, even when medical tests show nothing overtly wrong. These biological mechanisms may sound technical, but their effects are very real. In clinical practice, I've seen men who maintained a balanced, healthy routine and experienced stable prostate health well into their later years. Conversely, I've worked with others who ignored their body's signals and suffered through chronic, unexplained symptoms that could have been avoided with a better understanding of their own physiology. Understanding these processes isn't just about curbing habits. It's about gaining the knowledge to make informed decisions. If you're over 40, this could be a crucial step toward long-term prostate health. Next. To truly understand how something as routine as ejaculation can affect the prostate, let me share the story of a real patient, a man whose experience speaks volumes about the long-term consequences of ignoring the body's natural rhythms. David was 65 when he walked into my clinic. A rugged, dependable construction site supervisor from Nevada, he had spent most of his life active and healthy. But now he was troubled by frequent nighttime urination, a persistent sensation of incomplete bladder emptying, and a dull, lingering discomfort in his lower abdomen. He told me, "I just don't feel like myself anymore." For a man who'd rarely needed a doctor before, this shift was unsettling. As we talked more, a deeper issue began to surface. For nearly a decade, David had completely stopped all sexual activity, even with his partner. He believed that once he crossed into his mid-50s, that part of life simply didn't matter anymore. He also felt awkward discussing it, so he didn't. He buried it, thinking it was too private, too taboo. But his body hadn't forgotten. After a thorough physical exam and a prostate ultrasound, we found that David's prostate was mildly enlarged. His PSA levels were elevated, and the gland showed early signs of tissue inflammation and irregularity. It wasn't a serious condition yet, but the signs were clear. His prostate had slowly deteriorated from years of inactivity and neglect. We began with small, manageable changes: light daily exercise, increased water intake, a prostate supportive supplement routine. And most crucially, he began reintroducing a regular ejaculation habit, about once or twice a week, based on how his body felt. After just 4 months, the transformation was notable. His PSA levels decreased slightly. Nighttime urination dropped dramatically. The dull abdominal discomfort all but disappeared. And perhaps most importantly, his confidence returned. He sat across from me one day and said something I'll never forget. "I never imagined something this simple could change both my body and my mindset so much." David's experience is not unusual. Many men in their 50s, 60s, and 70s fall into similar patterns, either avoiding all sexual activity out of discomfort or overdoing it without understanding their body's limits. What they often lack isn't effort, it's guidance. One of the most common questions I get is, "So how many times a week is ideal?" It's a valid question, but there's no universal number. The answer depends on your age, recovery rate, hormonal health, and how you feel after each session. Here's a general guideline based on clinical observations and expert urological recommendations. Ages 40 to 49, 3 to 4 times per week. Hormone levels are typically strong. Prostate tissue still recovers quickly. Regular activity supports hormone balance and glandular health. Ages 50 to 59, 2 to 3 times per week. Start adjusting based on energy levels and urinary symptoms. If you feel drained after ejaculation or experience discomfort, ease up and give your body more recovery time. Ages 60 and above, 1 to 2 times per week. This frequency helps maintain circulation, reduce stagnation, and prevent tissue hardening. Overexertion can disrupt recovery and affect urinary control. Prioritize quality and rhythm over frequency. Don't go too long without any activity, but don't push your body beyond its limits either. A healthy ejaculation rhythm should be part of a broader lifestyle that includes balanced nutrition, light daily movement, adequate hydration, stress management, regular checkups. Your prostate isn't just a reproductive organ. It's a reflection of your overall biological harmony. Learning how to work with your body rather than ignoring or overtaxing it can make all the difference as you age. As we wrap up this discussion, it's important to recognize that the greatest obstacle to prostate health isn't always physical, it's psychological. The truth is, most men don't lack access to information. What many lack is comfort. Comfort to talk about sensitive, deeply personal topics without shame or hesitation. Let's make one thing clear. Masturbating after the age of 50 is not wrong. It's not shameful. And it's certainly not something to hide. Yet because of cultural conditioning, outdated social norms, and silent judgment, too many men choose not to talk about it at all, and in that silence, something far more dangerous happens. They stop taking care of their prostate entirely. Over the years, I've met countless men who sensed something wasn't right, but hesitated to speak up. They felt embarrassed, isolated, or even strange for wanting or needing sexual release at an older age, especially if they were doing it alone. But the moment they realized that ejaculation is simply a normal part of male biological maintenance, something shifted. They no longer saw it as indulgent or shameful. They saw it the same way we view brushing our teeth, going for a walk, or eating on schedule, a necessary act of care. And the results? Clearer minds, healthier prostates, and a renewed sense of confidence. This isn't just about numbers. It's not just about hormones or symptoms. It's about awareness. Your prostate doesn't need to be ignored simply because the topic feels awkward. It needs attention, at the right time, in the right way, and with consistency, just like your heart, your liver, your lungs. This gland deserves care. If you've stayed with me through this video, I can tell you this. You're someone who takes your health seriously, and that's exactly where lasting change begins. So now, I invite you to take one more step. Leave a comment below. Let me know your age group and what men's health concern matters most to you. Subscribe to the channel if you haven't already, so you never miss out on the deeper insights coming in future episodes. Because taking care of your body isn't just for the young, it's for the wise, those who know themselves, who listen to their bodies, and who understand that true health comes from within.